My name is Kale Edmiston. I'm a neuroscientist by training, and I'm interested in understanding developmental risk factors associated with mood and anxiety disorders. My work is important to me because I'm a member of a community that faces enormous mental health disparities, and I really want to help develop new treatments to prevent these disorders. The treatments we currently have are effective, but they're not necessarily effective for all people. And so one of my goals is to help develop new treatments that could be tailored to individuals to reduce or even prevent depression and anxiety. We know from a number of different studies that mental health disparities among trans communities are very high. So for example, we know that 90% of transgender adults report experiencing a major depressive episode at some point in their life. We also know that 40% of trans adults report attempting suicide at some point in their life, and that most of these suicide attempts occur during adolescence. So adolescence is a really critical developmental period. And so adolescence represents an opportunity for us to really intervene early to prevent mood and anxiety disorders. There's a broad scientific consensus that access to gender-affirming care for those who require it improves overall well-being, improves mental health. We have evidence-based clinical guidelines that support decision-making regarding gender-affirming care in adults and in young people. And the literature has shown time and again that rates of regret are very low, and they're in fact much lower than they are for many other common medical interventions. So we know that this is a safe and effective treatment for those who require it. An effective service is one that supports joint decision-making between patients, their families, and healthcare providers. So we know from the developmental neuroscience literature that young people are capable of adult-like deliberative decision-making, particularly when that decision-making process occurs over time and in the context of support from adults. Access to gender-affirming care reduces mental health disparities, and so I think it's really important that we trust families to make their own informed decisions about their healthcare needs. I think it should be important to others because depression and anxiety are incredibly common mental health concerns that affect a lot of people. I think it's important that we look out for each other and do our best to reduce the suffering associated with these disorders.